Guys, welcome back to Medical Coding with Blue. Today's episode is all about some advice if you are considering pursuing a career in medical coding. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, I have been a medical coder for 16 years. So the advice that I give today and through all of my videos here on YouTube comes from years of experience. So I got this message, and I'm going to read the message, and we're going to get into it. So here we go. So the viewer says, so I have been researching medical coding for a while now, and this is my second time around looking for answers. Not looking for answers from me, because I do not recall this person ever asking me this question. When all your education is done and your test is passed and no longer an apprentice, how long before you find a job? I've been hearing years. Please, someone give me a realistic answer, please. Okay, so here's the thing. When they say apprentice, they're referring to the Certified Professional Coder credential. That is a credential with the American Academy of Professional Coders. There's two major medical coding associations. There's the American Health Information Management Association. That's they have the Certified Coding Specialist. That is a gold standard of medical coding credentials. Doesn't matter what anybody says. That is the gold standard of medical coding credentials. The CCA, the Certified Coding Associate, the CCSP, the Certified Coding Specialist, physician-based. And as I said, AAPC, or the American Academy of Professional Coders, has their flagship credential. That is a CPC. If you get certified with AAPC, you will have an apprentice status attached to that CPC, because this says that you have less than 2 years of experience in the working world as a medical coder. But you can accelerate the removal of that apprentice status if you choose not to have it by going through their approved AAPC program plus completing the PractiCode. It is a separate educational product. It is not work experience, but this PractiCode says that you have completed what AAPC considers what would be done within the first year of employment if you were working as a coder. So that's what they consider it as. But it is an educational product. It is not meant to be work experience, and it is not an internship, okay? Just so you guys know. But the thing is, if you do all that and you get your apprentice status removed, you still have no experience, okay? So again, it's just another product for them to offer to their people for purchase, all right? But here's the thing. This person is looking at how soon can I get a job? This is not a good thing when I see somebody that is interested into this career field and that's what their first concern is. Because if that's their first concern, then their other first concern is, how much money am I going to get? Yes, we all need to get paid. That is very, very important. However, in a career like this, because medical coding, health information is not a job, it is a career. There is a difference between jobs and careers. Jobs are something that you can do just to make a little bit of money, like cashiering or something like that. While it is very important and it is a useful part of society, yes, it is not a career. A career is something that you have to become educated for, that you have to build your skill over time, and that kind of thing. So health information, medical coding is a career. This is something that you grow into. This is not something that you learn overnight. And a lot of people get very impatient. We live in a TikTok society. That's what I say all the time. Everybody wants the information in 5 seconds or less, which is why you will never see me on TikTok, period. I refuse to contribute to a society's dwindling attention span. You guys have to work on attention span, because the shorter people can get your attention span to be, the more willing you are to accept what is put in front of you without critical thinking. Think about that, okay? But that aside, okay, let's look at this. So not even into the career field yet, not even into the school yet, but they want to know how fast can they find a job. And when you start soliciting for people's opinions and things like that all over the internet, you're going to get different responses. And especially on Facebook, because Facebook is probably the most guilty of this, to have the negative groups. I have always said on my channel that I never recommend groups from Facebook. I have a group for Medical Coding with Bleu on Facebook only because you all requested it, and then I don't see a lot of engagement on it. And that's the thing, that I did this for you guys. If it was my choice, I would not have done it. But y'all wanted it, so I gave it to you. What you do with it is up to you. But the thing about it is, a lot of these groups on Facebook, they're trying to sell a program, or it's full of people that are being negative because they feel like they got taken advantage of, or, you know, there's just a lot of things. You know, they can't find a job, they can't get through the school, they can't pass the test. There's a myriad of things that they're complaining about on Facebook. And so sometimes it scares people and it runs them off because they say, oh, well, I tried to do research about medical coding and I went to Facebook and then I saw all these negative things, and so it just scared me, and so I decided not to pursue it. That's on you, because if you allow other people to drive you as far as like scaring you off from something that you think that you would be really great at, then you just lost out. That person, whoever drove you off, is not, you know, it has no bearing on their life. You know, people are more concerned with themselves than they are with others. So my first bit of advice is to stay out of these Facebook medical coding groups. If you want to go into medical coding, it is a growing career field. You can find that out on the Department of Labor or the Bureau of Statistics website, okay? You can look in your area and see that it is a growing field and that there's a lot of opportunities for growth in this field. Before anybody feeds you any garbage about, oh, it's going away in AI, blah, blah, blah. Guys, you have to understand something. AI is a tool. It is a tool. It's not meant to take over humans and critical thinking. It goes back to what I just said a little bit earlier about using your critical thinking skills, and how a lot of people, how, you know, they want everything right here, right now, and they don't have patience, and they want those 5-second, 10-second clips, and then they're willing to accept whatever's put in front of them. When in fact, you should be being more patient. You should be working on your patience. You should be working on your critical thinking skills. You should not believe whatever's being put in front of you like this person has. You know, two passes around trying to look for answers when the information's all right there within your fingertips. You can look and see that this is a growing career field. You can look and see that how to find your first job once you've completed a program, or even while you're in the program. I have so many videos about that, about how to find your first job in medical coding, how to improve your resume. I even write resumes myself. There's resume writers all over LinkedIn. If you don't want me, that's totally fine. It's not going to hurt my feelings. I don't care. What I want you guys to know is that you have options out there to help you. All right. It's not just about, oh, well, you know, such and such said this and such said that. It's about the career that you make of it. If you want to get into this because you want that intellectual challenge, you want a field that you're going to be able to grow in, and that it's not going to be so redundant and boring to you, this is the career field for that. If you don't mind reading for 90% of the day, this is the career field for that. But I've had people who say, well, Bleu, is it really necessary to be reading all the time in this job? Please don't pursue this. Just don't. Because it's not what you want. This is not about pushing codes through. This is not about, well, the doctors decides what the codes are, and then you just push them on through. No, ma'am. No, sir. We have a code of ethics that we follow as coders. And in this code of ethics, it says that we will look at the documentation. Obviously, I'm paraphrasing, but we will look and verify that everything is supported. And if it is not, we will change and adjust so that it is supported with the codes that are being reported. So that's the thing that you have to understand. We have a big responsibility as coders. I say this all the time. We have to know what doctors know while never having gone to medical school. And it's not to scare you, it is meant to prepare you. I want you guys to be prepared because you have to know medical terminology, you have to know anatomy, you have to know pathophysiology and pharma. There's all of these things that you have to know. You have to know about medical law and ethics. You have to know about HIPAA. And you have to understand what privacy means in this field, in health information, right? Not only that, you have all of the coding manuals that you're supposed to learn from, right? ICD-10-CM, which is your diagnosis coding. CPT is your outpatient procedures and evaluation and management codes. HCPCS codes are your product codes, as far as like if there's durable medical equipment, crutches and wheelchairs and things like that. There's other procedure codes in there that are specific to like Medicare. And then of course you have your ICD-10 PCS, which is your inpatient procedures. Not everybody has to learn that. If you are studying for a certification that is for outpatient, you will not have to learn ICD-10 PCS. Sometimes it is a part of the program curriculum, that you're going through. They teach you, or maybe they'll do like a general introduction on ICD-10 PCS, but it doesn't necessarily mean that you have to learn it, especially if you're, again, going for an outpatient certification like the CCSP with the American Health Information Management Association, or the CPC with the American Academy of Professional Coders. So it really all depends on which certification that you're taking. But should you decide that you want to go ahead and pursue medical coding, stop looking at these Facebook groups. Don't look at Reddit threads. Don't look at all these other platforms, Discords, anything that people are going to give their opinion, because it's like a runaway train when people start to get negative and they start to share their negativity, and negativity begets negativity. Okay, plain and simple. That's what it does. And so because of that, there's a lot of people that they go through, they get discouraged, and then they want to get lazy. They don't want to have to study. And then they come to my channel, and then you hear my words like, you have to study 20 hours per week. And people start hyperventilating that that's too much time, that they work a full-time job. If you want to do this, you will make the time to do this. If you want something different for yourself, your career, and your life, and maybe you want something better for your children or the people that you take care of, family members, your loved ones that you take care of, this is a great gateway to that, because this allows people to earn a very good wage. However, you have to work for it. This is not something that's just easily handed to you. Where you start in your salary, it's not always going to be like where you stay, obviously. You're going to start at the starting salary, which is reasonable to expect in the very beginning. Again, the Bureau of Labor or the Department of Labor or the Bureau of Statistics can give you that exact figure, because we do not discuss exact figures on my channel. And the reason that I don't is because I do not want to be a part of the chorus of people that tries to push this career field based on the money. And because every place pays differently, there are state-run hospitals, there's government-run hospitals, there's privately owned hospitals, there's private doctor's offices, there's federally qualified healthcare centers, and each one of these places pays differently. And so because of this, you never know what you're going to start out at sometimes. But as you get more time in the field and as you start to learn more, then of course you can command more salary. It's just a matter of time, and it's a matter of learning what you're doing. But sometimes when people, they have these ideas based on what somebody else told them, or based on, maybe a nurse told them something and now it's scared them. Again, stop telling people what you're doing. You'll need to start learning to move in silence when you're trying to start in a new career field, because people will give you their unsolicited opinions on your career choice and what you've decided to do with yourself and your time. But it's not their life, is it? It's not their life. It is your life. So again, if we can stop wasting time on researching all these things, like about how much money we're going to make, how soon can we get a job. I've heard people say that it's going to be years. Again, if you had watched my channel, you would know that you are supposed to apply for places even though they're asking for experience. Because if happy coders are in the area, they're going to stay. if you are somebody who has done their research, if you've watched my channel, you've updated your resume, or you've had your resume professionally done, and you can accurately give out your skills and say, this is what my skills list is, and these are all of my prior positions, and this is what is transferable to coding, even though it may not have been in health information at all or in the medical field at all, but there's still a lot of things that can be tied into this industry based on your transferable skill. And that's how you market yourself. That's how you start to get into the industry. It does not take years to get a job. When I first started, I had no idea that medical coding even existed. All I knew was that when my case manager told me, hey, this is going to be a career that you can get into, you'll have it for a long time, and of course it does pay well, but you'll have stability. You won't have to worry about getting laid off, because I had been previously laid off in my job, and that was what he was concerned about for me. And he says, you won't be laid off. This is a field that is needed. He goes, so why don't you just try it? So I was like, okay. So I went to the schools, I picked out a school, and then of course you hear people in the school talking, about, oh, this and negative that. Well, I decided not to listen to them because I was already in the program. There was no going back. There was no looking back and changing my mind and deciding on different things. Because I always tell folks, you get one rodeo. One rodeo means one lifetime. One lifetime. In your current lifetime, whether you believe in next life, right now, you are living this current life. You have one life in this life to live. Okay? I say this because somebody was very confused and they said, well, I believe you can have many rodeos in your lifetime. Me and my husband did this business, that business. I'm not talking about rodeo equaling career. I'm talking about rodeo equaling lifetime. Okay? So I am not going to allow anyone to affect what I do as far as in my lifetime. I'm not going to listen to these negative words from these people who have their own problems that has nothing to do with me. And so at the time I was going through a divorce and I was having to get back up on my feet. And I said, you know what? I'm going to do this. I am going to just get into this, whatever happens. It took me 2 months to find my first job because I went back to the school because I was like, Mom, I don't know what to do. Because I told my mom, I was like, Mom, I've been looking for a job and I can't find a job. I don't know what to do. She's like, go back to the school, go talk to the principal, see what he can tell you. Went back over there and I said, I graduated 2 months ago. I don't know what to do. And he's like, my friend has a temp agency that specializes in medical professionals. So go over there, get yourself some experience, something to put onto your resume, so that way you can go out there and find your job. So I went ahead and went with it. Wasn't really sure about it at first, but I said, you know what, let me go ahead and try. So I went out and they said, okay, we got a job for you. It's 3 months. And so I stayed there for 3 months at this Cancer Therapy Research Center, and I learned what I could. I moved on to my next job, which was for 8 months at a hospital. And then I came here to my forever home, all within the span of a year. So it doesn't take years. For those that are negative people, as far as like that they're always wanting to be not have everything handed to them. They want everything handed to them, and then they want to cry victim when it's not handed to them, and they want to get upset because they can't find a job fast enough. But they're not putting out a really good resume. They're not networking with people like they should, in the associations and things. And if you are with AAPC, they do have their job bank in AAPC, and they do have lots of networking events that you can go to. But again, a lot of people don't look at those things. They want things their way, and they want it now, and that's not really the case. But this is a really great career field that you can grow in, that you can enjoy, but you have to stop like soliciting other people's opinions on what you should do, or what are their thoughts, or what about this, what about that. Whoever told this person that it takes years to find a job, I mean, clearly they didn't try hard enough, or they had a terrible resume to begin with, or they never worked on their skills, or they couldn't pass a tinkle test. Okay, I shouldn't have to explain what a tinkle test is. Maybe they couldn't pass a tinkle test. Maybe they had something in their background that wasn't coming back clear on a background check. We don't know. We don't know what other people's situation is. So if you're concentrating on the things that you should be concentrating on instead of wasting time listening to other people, then you'll be okay. My channel is about straight talk, and it's forward and blunt, and some people may cry and say how unprofessional I am, and that's okay if that's what you think, because for me, what I think, and for those that actually do understand and get the message, it's going to help them. And I would rather it help those people that really get it than to be sitting out here selling y'all a bunch of mess and just trying to get y'all to buy things or trying to get y'all to participate in whatever freaking program is out there. I don't do that, because again, you can study on your own. And I have that whole list of all of the independent study and the syllabus and all the books that you need in the description box below. Again, it's your choice, whatever you want to do. But stop listening to other people. Make up your mind and pursue it if you want to, or don't pursue it. Either way. But don't let other people's opinion scare you or dictate what you do. I'm just saying. With that said, best of luck to you out there. And my whole channel has lots of videos on all kinds of advice. So take the time to look through the videos. And with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.